Hi my Liz, welcome back to my channel. Thank you so much for subscribing. If you haven't subscribed already, you can hit that button down there. But yeah, so today's video is going to be about how to maximize your clinical experience, at least how this girl did it. And I am so excited. Friday is my last day of clinical, capstone student, graduating, moving on to the real world. So I'm really happy about that. I had a really good experience in my capstone rotation, but I suppose that's a whole nother video. So first things first, in maximizing your clinical experience, you want to come to clinical prepared. So clinical preparation, depending on your program level, that will all vary. I personally, in my program, we started assessment. We, as a class, and we kind of practice on each other in not fundamentals, it's sophomore year, and then we started fundamentals, or like the core part of nursing, not like the bachelor's, like your general prerequisite science type parts or whatever. So I had a bit more familiarity with it, but main thing, come to clinical with mindset ready to learn, ready to work, have your stethoscope and any other equipment, your pen light, especially if you're on a neuro floor, just ready to go. The next thing is, you want to go into clinical with the mindset that you want to learn and even have things you want to specifically see in clinical practice. A lot of times, in a lot of my clinical rotations, the professor or the clinical instructor would ask, hey Kadrian, what do you want to get out of this semester? Is there any specific patients you would like to work with, or would you like to see this specific procedure? Like, would you like to see how a Foley gets put in? Would you like to try one yourself, depending on where you are? My state, students are not allowed to do that now, or we're not allowed to put in IVs and things of that nature, but different opportunities you should just seek out and just have an idea of what specifically you want to do. What I would do is I would typically go to my syllabus and see what I was learning in class by those specific weeks, and I would talk to my clinical instructor like, hey, we're going to be focusing on cardiac this week. Could you give me a cardiac patient, or could you assign me to a nurse? Even if that's not my patient, assign me to a nurse that has a patient like that I could work with her and I could shadow and really learn and see how things are done in clinical practice, and seeing how patients with these different comorbidities, how they relate to the cardiac meds they're given, how they're monitored, the specific interventions, and seeing everything play together. And that kind of accompanies your theory in class and just acts as a solidifying glue. So now when you're in the exam, you're like, oh, okay, I remember Mr. John Doe, he had this, and we had to make sure to look out this, and we had to check the parameters before we gave this. Things that nurses do in everyday clinical practice, you won't be used to knowing as a nursing student. Now, me as a capstone student, there's certain basic things I'm like, oh, okay, that's standard, that's basic, but especially when you're coming in as fundamentals, nursing is like new, totally new. So you kind of want to submerge yourself into what interventions and things the nurses is doing, and coupling it with theory as much as you can, and going about and making sure it is that way. Very much facilitates the learning process, and it even makes studying for exams easier, because sometimes I'd ask like, hey, I learned this in class, but this doesn't like seem to make sense to me. Do ask questions. You are there to learn, so ask those questions when you can. And like when someone's pulling you in, like, hey, there's a code, go and see what that is about. It's nice to just be able to watch, because as a nurse, when that's your patient specifically, like that's so stressful, but like being able to learn and see everything that needs to go on without all that pressure is a good experience. As well as, let's say your instructor offers for you to like rotate off the floor or see something different. Those are great opportunities, because as a real nurse, you won't just be floating off the floor to watch random things. Like, for example, in my clinical experiences, I went to wound care, I went to the OR, I went to diabetes clinic, nutrition, and these are all things that are not specifically my specialty as a nurse, and more than likely I'm only going to be, and I probably won't be going into some of them right out of graduating school, but it's good for me to see how different professionals work together in their role, and how different specialty nurses, and see what I potentially might want to get myself into in the future. But yeah, this was my video, and thank you so much for tuning in. Don't forget to like, share, comment, and subscribe.